We appreciate you coming. We have some sad news to share, not only with the Denver community, but with the EMS community as a whole. So Rick is going to read a prepared statement this afternoon. One of our paramedics, Paul Cary, who was deployed to New York in support of our task force efforts in support of the state of New York, has passed away this afternoon. And so Rick is going to read a statement, and then we're happy to take any questions that you have afterwards. Rick?
Well, my name is Rick Diemert. I'm the operations manager for Ambulnz, an EMS and non-emergent transport company with more than 1,000 employees across 8 U.S. states and the UK. We serve numerous communities. The Ambulnz family is absolutely devastated by the loss of our Colorado paramedic, Paul Cary. 66 years old, Paul was part of the Ambulnz's State of New York COVID response team. He volunteered for assignment at the epicenter of the COVID-19 pandemic in New York City. He contracted the virus while caring for New York City patients, and despite the amazing care of the talented staff at the Montefiore Hospital in New York, died earlier today. He had been in ICU and on a ventilator for several days. Paul's career is best defined by his kindness and dedication, service to others during his time as a paramedic at Ambulnz, and before that, as a firefighter and paramedic of more than 30 years with the Aurora, Colorado Fire Department. Paul made the ultimate sacrifice for his country and will forever be remembered as extremely dependable and completely devoted to his work. He is survived by 2 sons and 4 grandchildren, and his family has requested privacy during their time of grief. Funeral details are pending, and we will share them as soon as possible. On behalf of the entire Ambulnz family, we want to thank our extended family, the New York Department of Health, New York Fire Department, UC Health, Aurora, Colorado Fire Department, the Colorado State EMS Division, and the AMR-led FEMA Response Partnership. Thank you.
So you mentioned 50 folks at some point decided they were going to go back east, correct?
At the peak, there was right at 72 or 73 employees deployed. Today, it's right at 50. We had 12 total from our Colorado market that deployed to New York.
12 from Ambulnz in Colorado.
Correct.
Yep. Do you remember Mr. Carey, any conversation with him saying, I want to go, I want to be there?
He was, if you knew Paul, he was extremely devoted to his work and very excited about going. And in fact, before he got sick, was anticipating doing a second deployment in New York City. He was very, very devoted.
What were his specific responsibilities, Paul?
Yeah, sure. As a paramedic in New York City, they were working on the FEMA deployment, obviously, which consisted primarily of the transport of COVID-19 positive patients.
Which part of the city specifically was he located, or was he covering all of New York City Metro?
Yeah, Denver Metro. So Paul
he was in New York City.
Oh, you're talking about in New York. I'm sorry. Yeah, he was in New York City.
Which part of it?
I think all over. I mean, predominantly the boroughs, but I think he was working pretty much everywhere in New York City.
And Rick, you said you worked with him closely. Tell me more about the type of person that he was. Obviously very caring, certainly big in the community, being a firefighter for 30 years. But talk to me about what you know about him.
Yeah, no, he was, well, the one thing about Paul that I think resonates more powerfully for me than anything is the fact that he was devoted to his work in such a way that, you know, he would be the guy that would be available to pick up a shift whenever it was needed, pitch in with whatever project was needed. Really, really dependable gentleman.
Paul was 66 years old, which is considered at risk. Did anyone ever voice any concerns about him going over there, given his age?
Well, we don't discriminate. You know, I mean, based upon age, you can't discriminate against a gentleman who really wants to go in and be of service to his country.
You can't discriminate, but can you also be cautious in that sense? I mean, someone that is in that age range and say maybe you're not the best fit?
No, I think it's a fair question. I mean, I think what I would say
absolutely.
is that, you know, Paul spent 30 years as a paramedic in Aurora Fire. Paul came to us as a very seasoned paramedic and a very skilled paramedic. and that skill set was definitely in need in New York to help out. Sorry, the nature of it. But Paul, I think Rick alluded to this. Paul was very adamant about being a part of this response, and very much wanted to be a part of it. And as Rick said, wanted to continue to be a part of it as he landed there in New York.
When did Mr. Carey first deploy to New York, and of how many Coloradans?
Yeah.
Where that?
There was a group of 12 Colorado employees that deployed on March the 26th, late in the afternoon. They drove 6 ambulance vehicles to New York. It took them a couple days. They stayed in a hotel overnight. I think they arrived in New York either late on the 28th or early on the 29th. And then Paul started his deployment on April 1st.
Sir, I understand what you were saying with the previous question, but just to final thought on that.
Yeah.
If someone, is 66, obviously a firefighter and well-seasoned and in good condition.
Yeah.
On your guys' end, though, is there no conversation that might say, maybe Paul, this is not, maybe you shouldn't. I understand the passion, I understand the commitment, but is there any part of that that's, if you're in that age range, that maybe you shouldn't go?
We had conversations with every employee that agreed to deploy, just around the nature of the business, what they would be doing in New York, the patients that they would be serving in New York. And like I said, I think Paul was very adamant that he was going on this deployment and very adamant to be a part of the deployment. But we had those conversations with every single employee.
Did you have concerns, though, with him being that age?
No.
When did he start to develop symptoms? And did he stay in New York the entire time? Did he come back to Colorado or anything?
Yeah, no, he's been in New York the whole time, and Rick can probably help me with the timeline. I think Paul developed some symptoms sometime on the 19th or 20th of April, and it was admitted to Montefiore
on the 21st.
On the 21st. And as Rick said, at some point in time, he was transitioned to a ventilator, and then we got news this afternoon that Paul passed away.
And what specifically this afternoon did you get that news?
Later this afternoon.
Yeah, I don't recall the exact time. It was later this afternoon.
Did he have any other underlying issues, health issues?
Not that I'm aware of, no.
What is it about your profession that, again, you get the call and you just go? I mean, firefighter, paramedic, what is it about that's inherent in what you do that says any place, any time?
Well, in my experience in working with some of these fine gentlemen and ladies out in the field, it's the desire to help. It's the desire to pitch in for the betterment of society. That I think resonates very powerfully with Paul's memory as well.
I know in your statement you said that the family's requesting privacy. Have you guys spoken with them, and do they have any words to share about Mr. Carey?
We have. I think the family's going to issue a statement later this evening as well. But yeah, we've been in contact with the family.
Any further questions?
Again, thank you guys for coming out. We'll clearly have some additional information as it develops, and really do appreciate it. And once again, it's a sad day for us, but I think it's important for all of us that Paul be remembered as what he was, which is a hero helping save lives. So, thank you so much. Appreciate
Very much
it.
appreciate it.
Yeah, thank you.